Imagine a child stricken with a disorder so rare that there are less than 350 cases in the world. Now imagine that there is no cure. Unfortunately, there is such a disorder. It is a disorder that has a major effect on childhood development. This disorder is known as AHC, or alternating hemiplegia of childhood. AHC is a rare neurological disorder in which repeated attacks of paralysis occurs. According to the Alternating Hemiplegia of Childhood Foundation, the number of known children diagnosed with AHC in the United States is less than 100, and worldwide it may be less than 250. Due to misdiagnosis, it is difficult to determine how many children actually have AHC. There is treatment for AHC, but it is only temporary, and it only temporarily relieves the symptoms. With less than 350 known diagnoses of AHC in the world, there has been little progress in finding a cure. Alternating hemiplegia of childhood is a rare neurological disorder that attacks the body, leaving the victim with hemiplegia paralysis, meaning part of the body can display weakness in the muscles or full-blown paralysis on one or both sides of the body. These episodes of paralysis can last for minutes, hours, or even days. Episodes of paralysis are a severe setback in childhood development. When an episode of paralysis strikes, it is a devastating setback to the child. During early childhood, it is important that they run, play, talk, fall, and do everything they need to help them learn. But if a child experiences paralysis, they are unable to practice these important building blocks of learning and muscle development. The paralysis strikes the patient physically and mentally, delaying any progress to the child. Due to the reoccurrences of these episodes, a child can start having seizures, which can lead to mental retardation. In severe cases of paralysis, it affects a child's ability to swallow and eat solid foods. According to the National Organization for Rare Disorders, symptoms usually begin before the age of 18 months. There is no known treatment for AHC. In many cases, sleep seems to ease the symptoms, but only temporarily. A drug called GHB is one drug that has been known to relieve the symptoms. This drug is similar to the date rape drug, and researchers believe that the drowsiness this causes helps relax the patient, and thus relaxes the symptoms. However, there is no known treatment for AHC, and there is no cure. A clinical case article from Neurology.com stated, "It has a reported incidence of 1 in 1 million children, but this may be due to an underestimate misdiagnosis." As I indicated before, there are less than 350 children in the world with this disorder. Sadly, my 6-year-old cousin Carter has this rare disease. I called Carter's mom for this speech and asked her the following questions. When did you notice Carter having his first episode? What happened? What did you do? How often does he have an episode? And how much money is needed to start searching for a cure? She said when Carter was 2 weeks old, he had his first episode. He started to cry and went stiff. These episodes continued about every other week. She would take him to the emergency room, and they said he had acid reflux. They put Carter on medication for the acid reflux with no changes. The doctors decided that maybe it was seizures. The doctors did an EEG to read his brainwaves, but everything looked normal. They tried seizure medication, but still no change. He was still having episodes. These episodes lasted from 5 minutes to 30 minutes. Then came the big one. He was 9 months old, and his episode lasted half the day. He finally went paralyzed on his left side. Sarah thought he was having a stroke, so they drove to the Mayo Clinic in Rochester, where he was admitted for free testing. After a week, they had no idea what was wrong. All of his tests came back normal. Later that week, Sarah was told that Carter had AHC. From that point on, his episodes were more of paralysis than the stiffness and eye movement. His episodes of paralysis last anywhere from 3 to 14 days now. These happen about every other week and every few months. He has what they call a bilateral attack. During these episodes, he loses all function, including walking, talking, and eating. He needs complete assistance while in these episodes. They have been to Utah and tried to get an experimental drug, but found that the drug actually made him quit breathing. He is no longer on this drug, taking this experimental drug called sodium oxybate. According to an AHC article on WebMD, the exact cause of AHC is unknown. Some cases of AHC may be inherited as an autosomal dominant trait. Most children die in their late teens or early 20s, and so Sarah and her family are fighting against time and hoping to help raise millions of dollars to find a cure for Carter and all children. We hope it won't be too late.